way back in the day, there really was not a structure in place in most states to provide services and have resources to help communities carry out a mission in rural health care.
The federal government couldn't quite figure out how to deliver care to rural areas. And in order to do that, the Office of Rural Health Policy was created in the late 80s, and out of that came some possible funding to create state offices of rural health.
They were there to advocate on behalf of people in rural areas to try to improve the quality of health care that they were getting and their access to health care.
There was a groundswell of people that were in what in the early days was Primary Care Association, which eventually became the National Rural Health Association. I largely credit Jim Bernstein in the North Carolina Office of Rural Health and traveling the country in the 70s to talk about how they created their office and what benefit was it to actually bring attention within a state Department of Health to rural communities and rural issues within states.
We were the first 5 rural offices of rural health. I would say that the uniform model that those 5 offices sort of created was that whole service model mentality, that we weren't offices that were simply studying the problem. We were actually trying to provide services to solve the problem.
We felt something unique could happen. We worked really hard together. There weren't very many of us. We were very passionate about what we were doing.
So it was important to have a way to be able to network and share resources and advocate for what was needed.
When the states began to understand what they were each doing, they had a much greater opportunity to pick up innovative programs from other states and use them within their own states.
We were able to more successfully accelerate the sharing of knowledge and information so that good ideas that maybe happened in Wyoming could be, deployed in North Carolina or South Carolina or Iowa, wherever.
Get 5 state office of rural health directors on the phone in those days. Half hour later, you got the solution. I mean, that was, they knew what was going on. They knew what to do. They were living this.
It was really driven by the Office of Rural Health Policy, which is pretty unusual from my 20 plus years working with the federal government, where you had an office who was willing to, in effect, experiment, to create something from nothing.
And the state offices know the communities, they know the hospitals, they know the state players, they can bring them together. I mean, it goes on and on and on, why having state offices supporting state offices was important.
When the state office program was established, there was something very unusual that was done in appropriations. It required a 3-to-1 match, which was cash. So every state to participate had to put up 3 cash dollars to every federal dollar that was put into the program. And that was really unheard of. In fact, to this day, I've never seen a 3-to-1 cash match program ever replicated. But I think it spoke to states being very interested in sustainability and to investment behavior, that they were critically interested in wanting to establish those offices and to being in partnership with the federal government on the initiative.
The idea was, well, maybe we should get some federal funding as sort of startup money for these offices and then make it institutionalize it in such a way that the state legislators are incentivized to provide support, and over time we let the states take on their role of helping to support these, and in fact that's what we did, and it worked out really quite well.
It was a way for the federal government to kind of put their money where their mouth is. We want a focused, devoted Office of Rural Health in every state. So that was a great, I was glad to see that happen.
I was obsessed, I think that's the right word, with getting 50 state offices of rural health.
The reason that 50 states were so important is that there are rural areas in all 50 states, whether that's Hawaii, Alaska, New Jersey, Maine, you name it. there are rural places, and in some cases, we actually share, or the people in those areas share, very common needs.
The state office program uniquely took on being a caring group of people, the cadre of professionals that actually came to listen and be compassionate with rural communities were people that actually were your neighbors and your friends.
The State Office of Rural Health movement, if you want to call it that, has been successful because the early vision, the early players believe that this really needed to be not only a vision, but a mission that was built on relationships, because if you work in rural areas, you quickly realize that everything is done based on relationships.